So for this next video, I'm going to be showing a CPA and UPA of the lumbar spine, as well as a sideline gap mobilization. So for the assessment, I'm going to have my patient lying in prone. And I'm going to lift his shirt up a little bit just so I can get easier access to the skin. So for finding the lumbar spine, a way to do it is palpate up until you feel about rib 12, which roughly right here. And this is approximation of L1. So for a CPA, it's much like with the thoracic spine. It's just locking the skin out, pressing down, checking for that mobility and any symptom of reproduction. Sorry, Dad.
Oh, good.
And then for a UPA, I'm just going to do it on his right side just for just to speed things up. So for that L1, it's kind of like with an upper thoracic where you kind of have to go at the angle so that way you don't get in the way of the 12th rib. And then skin lock and then after that it's just like a normal UPA. Skin lock across. Skin lock. And skin lock. Alright. So that is for a CPA UPA assessment. And for this next part, I'm going to ask the patient to lie on his right side. And then come towards me a little bit. That's good. Go ahead and cross your arms like this. There we go. So for the sideline gap mobilization, first I'm going to move his foot into the popliteal fossa as far as I can. As far as I can go, Dad?
Yep.
Okay. And can you scoot a little bit closer? There we go. And then I'm going to ask him to rotate his body to the left a little bit, just until it feels comfortable. Right there, fine. Okay. So then going on my left, I'm going to go underneath. Go ahead and relax, you don't need to fight me. Trying to find the articular process of whatever one I'm going to be working on. So let's say it's probably L3. We'll say L3, going off that articular process. And then coming up behind his hip, I'm going to palpate for the transverse process underneath it. They're tender. I'll go gentle. And then I'm going to have him rotate, and I'm going to rotate him a little bit, continue the motion. And then if I was to do manipulation, it would just be a quick thrust down. But I'm not going to do that, so just all about pressing down, trying to move that joint. How's that feel?
Okay.
Okay. And that is a CPA UPA assessment of the lumbar spine, as well as a sideline gap mobilization of the lumbar spine.